Dear colleagues, we are waiting for one of our panelists to join. So thank you for your patience. Um, so we're waiting for Dr. Dia Saminarsi to join. Um, just give us 2 more minutes. So in the interest of time, while we begin, while we wait for everyone to get connected, I'd like to start by welcoming all those of you who've joined. It's really a pleasure to see you all here at this important webinar on mobilizing youth to end TB. Um, this is really an important issue, given that we need all hands on deck to end TB, which remains one of the top infectious killers in the world. And while we've engaged a wide array of players, the one player who we haven't fully harnessed the potential of in the fight to end TB has been youth and young people. There's really so much potential there, so much innovation. They're change makers. They can, really, they're game changers basically. And um, while we have, while WHO has initiated first steps in this regard, we need to really step up our efforts to mobilize youth to end TB. So the aim of this webinar really is to showcase how WHO has already begun to engage youth in efforts to end TB. We have thousands of youth engaged already, and we're really happy about this. We have a strong set of mentors and leaders leading this work. We're very thankful to Dr. Teresa Kasaeva, who is the director of WHO's Global TB program, whose brainchild this has been. She has been pushing forward this agenda from the time she took office at the World Health Organization. I think it's been really important to drive this agenda. We also have young people leading this work at WHO. We have 3 young people. We have E. Wong, Madhusudan Kafle, Anna Stukalova, all 3 who are basically the young minds behind all of this work. And I'm Monica Diaz. I lead the work on at the WHO Global TB program on 3 areas, the WHO Director General's Find, Treat All, End TB flagship initiative, TB elimination, and public-private mix. The reason I mention this is because under the Find, Treat All WHO Director General flagship initiative, youth engagement is a key component, and all of this work really falls under that. So while we wait for a few of our panelists to still connect, what we'd like to do is kick off with an icebreaker. And I look to my colleague, E. Wong, to introduce the icebreaker so that we can do this while we wait for everyone to connect. So, E, over to you, please.
Thank you, Monica. Good morning, good afternoon, good evening, everybody. My name is Wang Yi. I work with Monica, Anna, and Madhu from Nepal together at Global TB program to support the mobilizing youth to NTB this program. So let's get started with with a little game. So if you could see, I'm sharing my screen now. Please let me know if everybody can see it. Just very simple. Prepare your smartphone ready side with you. Go to the link on the top. You can see it shown on the top. www.menti.com. Go to your browser and type to this website, and then enter the code 4964850. I hope everyone can join me in this little game. It's just it's a quiz. We will just share some simple questions to with you. Yes, I can see there are people giving comments. I can see they're sending hearts to us now. So the first question I would like to ask, use one word to describe your feeling today. As you can see, the question is on top of this page. So I hope I can see the answers from all of you. Type the feeling. Use one word to describe your feeling today. Oh, thank you. I see a lot of people giving our comments. We will see the result later. Let's go to the next question. So, which country are you from? Can you see? I can see the. Okay, so please type which country are you from? And let's go to the next one, which will lead to today's session. Have you heard of WHO's 1+1 Youth Initiative to NTB? And are you familiar with the content? Please type us the answer, so we will see the results later. Thank you for the participants. So we will show the results later at the end of the event. And thank you for Monica to give this opportunity to get started. Let's go to our session. Thank you, Monica.
Thank you, E. If you can stop sharing. So this is a very quick icebreaker to get a sense of how much, what the knowledge levels are. And yes, to also understand who all of you participants who've joined us now, especially now that we're especially now that we're in the level of, nearly at the holidays. It shows that all of you who've joined really do prioritize efforts to NTB. So thank you for that. I'd now like to turn to, as I mentioned, Dr. Teresa Kasaeva has been critical to drive this agenda forward. She is the director of WHO's Global TB program, and she has been the main driver of youth engagement to end TB. Also with her, we have Dr. Dia Saminarsi, Senior Advisor on Gender and Youth for WHO Director General Dr. Tedros. Again, a person who has been driving the overall youth agenda for health, and you will hear from her after Teresa. So I'd like to welcome both Teresa and Dia. Thank you for making time from your busy schedules. Let me start. Dr. Teresa Kasayeva, please do start with your opening remarks and welcome. Thank you.
Thank you very much, Monica. Hope you can hear and see me. It's great pleasure to join this very exciting event, webinar. Dear colleagues and friends, I'm happy today to spend this time together with you and brainstorm, discuss our plans, how we will all together combat with this biggest infectious killer in the world, which is TB. Probably you will think that it's COVID. Of course, COVID is new threat, but TB is still one of the biggest killer in the world. This webinar is for the young and the young of heart who wish to join and support WHO's initiative and global youth movement to end TB. There is no age limit. As future leaders and drivers of progress and innovation, young people are our greatest assets. Harnessing your potential as agents of change is vital to advancing the fight to end the deadly epidemics such as tuberculosis. Young people are also disproportionately, unfortunately, affected by TB, with the age group of 15, 40, 34 years among the most affected. Young people also from the majority of the population in most of the high TB burden countries. Recognizing the strategic role of young people and your strength as the powerhouse of health development and efforts to end TB, WHO launched a new initiative titled 1+1 on occasion of the World Tuberculosis Day in 2019. This was also my dream and vision, and I was inspired by young people reaching me out of social media and asking how they can be change makers, real leaders in ending TB. WHO 1+1 initiative aims to advance the engagement and amplify the voices of young people in the fight to end TB. The initiative relies on small actions, really very simple steps that young people can excel at and multiply effect utilizing the untapped resource of youth. In each one reaching one, you can reach the millions we need to end the epidemics. There has been significant progress over the past years since the launch of the 1+1 initiative to end TB, followed by the adoption of the Youth Declaration to end TB at the first ever Global Youth Town Hall on ending TB in Indonesia. The 1+1 initiative has expanded to include thousands of youth across the world, spanning countries such as Bangladesh, Nepal, India, Indonesia, Kenya, Philippines, Russian Federation, Vietnam, and many, many others. The NTB Global Youth Network, established by the WHO Global TB Program, covers 6 regions with members from more than 95 countries. My young colleagues will present information, statistics, and updates on key progress made to date. As highlighted by our Director General, Dr. Tedros, today's youth are restless and full of energy. They can bring significant change as owners of the world and as owners of the TB issue. This is true, especially today, as we tackle both TB and COVID-19 pandemic. We need the power of youth to change the story, to end TB and other diseases once and for all. I'm really proud to join you together with my colleague Dia Seminarish, Special Advisor of the Director General, and her position and her active and tireless work also highlight the importance of youth engagement. You are our future, and you are the most proactive and innovative part of the world's population. And that's why only together with you, hand in hand, we can combat and we can help to the people suffering from the preventable and curable disease and TB. We should share knowledge about the problem. We should share information how people can reach services, how they can receive necessary care, and how we can bring the changes into their life, very positive changes. It's time for more youth power and more youth mobilization. Together, we can and we will end TB. Thank you very much for your commitment.
Thank you so much, Teresa, for your inspiring words and for your opening remarks. We really appreciate your commitment and dedication to youth engagement and ending TB. I'd now like to move to the next high-level speaker we have. So have you noticed that WHO Director General Dr. Tedros really spotlights youth a lot? He's always engaged with young people. There are a lot of new initiatives. You may have seen the recent press releases coming out on youth engagement for COVID-19, or you may have seen the numerous town halls that have been held across regions globally, and all the innovation around young people. Well, the person responsible for that behind the scenes, who you may not always see, is Dr. Dia Saminar C. She is Senior Advisor on Gender and Youth for our WHO Director General at WHO, and the driving force behind youth engagement for health overall. And we're really pleased that even though, again, like Teresa, she's on leave, but she's joining us from Indonesia. So Ibu Dia, over to you. Thank you so much for making time to join us.
Thank you, Monica, and warm virtual hugs to you, Teresa, and also you, Monica, from afar. Hello, colleagues, participants of this webinar. I'm sorry for joining in late, but I'm glad now I can make it here and meet all of you. So I'm Dia. My job in WHO is to advise Dr. Tedros on gender and youth. And as Monica has pointed out, this year, there seemed to be an acceleration of young people engagement with WHO. The last being our upcoming project with the Big Six youth groups. And the biggest one it has been announced by Dr. Tedros is the launch of the WHO Youth Council, which is an umbrella structure of youth engagement, and that's the platform, means of communication, means of dialogue between young people and directly to Dr. Tedros and also WHO senior leadership. Right now, we have identified a core subgroup who is in the process of identifying ways to engage for other organizations. The youth NTB is definitely one of the key cohorts that this council will engage very soon, and we look forward to welcome youth representatives from youth-led organizations in TB, because it is still, like what Teresa has pointed out, a very a crisis on its own. It has been with us for too long, and I think we look forward to have one of you represented in the WHO Youth Council. I will come to you to engage you further on that, and in the process, hopefully by the second week of January, we will have a more concrete list of organizations that are part of this WHO Youth Council. And this council is by no means set up to undermine the work that each of you has done in TB. But on the contrary, it is set up to boost your work further, and to create a direct link to Dr. Tedros. So, and as Monica has pointed out, he genuinely enjoys the exchange with young people. And this council is set up with from his mandate, his directive to me, and he wants this to be as open as possible, as engaging as possible, and as autonomous and independent as possible. So my job is to ensure that this council is really a platform where young people can determine what they want, how they want this council to look like, and what do you want to as an outcome of such council. My commitment is to definitely, it's not going to be a tokenistic engagement from us, from WHO to young people. So for example, the chairperson in the meeting, in this coordination meeting, is still rotating between the members of the subgroup. And then later on, the organization appointed as chair will also rotate. So we want all the young people have the chance to lead this council. It is your council. It is not our council, not mine, not Teresa's, not Monica's. It's your council, and we want your voice to be clearly heard by us in WHO, and to support us to function as a platform of dialogue between the young people and Dr. Tedros and us in senior leadership and in management. So I hope that part of us, that this part, the WHO Youth Council, can be discussed during your proceedings. And please do engage me further if you would like more clarification. Unfortunately, I cannot stay with all of you until the end of this meeting. I will have to get myself from this point to my house. But when I get there, I will reconnect and rejoin you. So if you have any questions, I will be there to answer and give clarifications. Again, WHO is committed to work closely with young people. Not only Teresa and I, our colleagues in other departments, directors, ADGs, even the boss himself, we are very committed to work together and to collaborate with young people. I think now is the best time to do it, and we shouldn't wait any longer. So look forward to your enthusiasm in joining this WHO Youth Council, and for me to support you in any way I can. Thank you, and see you soon later. Thank you.
Thank you so much.
Bye, Teresa. Bye, Monica. See you.
Bye, Dia.
Bye.
Thank you so much for joining and for delivering this
Thank you,
address.
dear.
Really much appreciated. And already I can see a lot of interest in the Youth Council. We've all been talking about it among ourselves as well. You know, it's very exciting that there is a strong WHO Youth Council, and thank you for reiterating the commitment at all levels in WHO for youth engagement. So we will definitely be in touch, and we definitely want to be engaged. I think that comes across from everybody engaged here. So we look forward to reconnecting with you.
Yes, I will. I will reconnect momentarily. Thank you. See you
Thank you
again.
so much. See you, dear.
See you.
I'd now like to turn to our next speaker, who is probably one of the most important. She is a young medical student from Indonesia. This is Faradiba Zalika Fatah. Apologies if I have mispronounced your name. But Farah, thank you for joining us. The reason we are very happy to have you is not only are you a young person, a powerful advocate, but also you have been through the painful journey of not just TB, but drug resistant TB and extensively drug resistant TB. I mean, I was very touched when I saw your story. Being a medical student, you fell ill not just with TB for 6 months, then MDR TB, then you found out it was XDR TB after more than 3 years of treatment. After a very long, painful journey, Farah has been finally cured last year in December. She is now a member of IMUT, Young Indonesia for Tuberculosis, and Farah is now encouraging and inspiring more young people as well as TB patients and survivors to join the cause to end TB. So Farah, thank you so much for joining us. I turn it over to you now. We look forward to hearing from you, you who have personally experienced what we are all fighting against. And we look to you also for words of inspiration on what we can do ahead. Over to you, Farah.
Thank you so much, Monica. I'm being so honored to give me opportunity to join this webinar. Hello, all. My name is Farah Diba. I'm 25 years old, and I'm TB survivor for 2 times. My journey recover from TB was filled with up and downs. Initially, from having diagnosed with drug-sensitive TB to recover from XDR TB throughout my medicine bachelor degree. First phase, I experienced living with drug-sensitive TB, in which I was in denial, feeling hopeless, depressed, distrustful, and feel, like I'm so felt excruciating pain, fever for months, and also always carried febrifuge anywhere. And the second phase, I was diagnosed with MDR TB. I went through the first 8 months with a very optimistic point of view, but it faded when I was shunned by friends who have always been with me. I was told to leave the campus to avoid transmission, and some people judge me how I'm a doctor can be sick. And at the same time, there was family issues that never end. As a young person whose happiness lies in friendship and family, I felt that hope was no longer there. That's the reason I consciously decided to stop taking my MDR medications. But surprisingly, my mother guessed right that I was not taking my medication. One thing that motivated me to resume my treatment and get full recovery is saying the pain is unavoidable and it hurts even more if you continue to fight it. Just follow the pain until you become friends with it and leave it to God. With my mother constantly on my side, finally I began the last phase. I started XDR treatment stage for 24 months. And in this phase, I genuinely accepted the situation and all the risks. All the phases of TB treatment have their own interesting stories for me and emotional journey that also develops my maturity. But I'm sure such a growth and strength is not only in me. I believe that with love and compassion, all my friends who are still taking their medications out there can be strong as I am to finish their treatment for sure. The struggling and recovering from TB is not only for me, but also for my mom and my family. She accompanied me to take medicine for about 3 years. And living with TB for so long initially made me more of an insecure person, honestly. However, one string of encounters and events woke me up. In Jakarta, we are paired with the peer supporters who have survived TB. That is how I met someone who initiated the youth movement in Indonesia. I knew her from when I had MDR TB, but I always avoid her. And we became friends when I was XDR. During my late months of XDR TB treatment last year, she put me in an uncomfortable zone, that is to attend Youth on Hall TB in Jakarta. That's the photo you can see. And I burst into tears. I'm sorry. I
No
burst
worries,
into
Farah.
tears.
No worries, Farah. Go ahead. We feel your pain.
I just remember that moment because that's touching my heart. I was still fighting for my recovery, and even brought up much enthusiasm. For the first time in many months, I know that I'm valuable for others. That's I'm feeling. That's why I feel this is the important moments and events for me. I felt encouraged to speak up more, including in social media, to motivate and to share information about TB, especially for those whose youth was spent on treatment or other who may be struggling. I just want to say that you are not alone. Believe me that just to side with the smallest ounce of hope within you, even though you have to limp and crawl to recover from TB. And sometimes the people with the worst past can create the best future. It is also often said that youth is the world's hope for a better future. However, all young people also need hope to live in a world without stigma and discrimination. To get there, we need a world with meaningful collaboration for youth to change the world. And therefore, I would like to thank to WHO for organizing this event, which allows us young people to take part in the fight against TB. I know that with the strength of young people, we can end TB together. Thank you. That's it.
Farah, thank you for sharing your story, your journey, completely there with you. It's really one of the toughest things to face. And we are so inspired by your bravery, by your courage. And you are a model for other people around the world. And we would very much, we very much welcome you as a young TB NTB leader and NTB champion, because that's what you are. You are a champion. You have beat the odds. I think there are very few people out there who can claim what you have done. And not only have you beat TB, MDR, TB, and XDR TB, you have picked yourself up and you're helping others to do the same. Because we can all talk about ending TB, but you've lived it, and your experience, I think, can really help make the change. So extremely grateful to you for coming on, and even though it's been so difficult for you to be courageous and to share your story, thank you, Farah. We are with you, and we hope that you will continue inspiring more people and join us as we fight to end TB. I'd now like to go back to my colleague, Yi Wong, who started with the icebreaker. And I think perhaps it's time to look back and see what we know from all of you from this quick icebreaker. So, Yi, would you like to share with us the results of the questions you asked at the start?
Thank you, Monica. I just quickly go through the results. As you can see from the screen, over just 5 minutes, we had around more than 20 youth from different countries joined us. They're from Pakistan, India, Nepal, Ukraine, Australia, Indonesia, Belgium, China. So this is a really a great start, and now I can see participants joining us a lot more, and so we're happy to have everyone here. And the questions that are asked at the beginning, have everyone heard about WHO's 1+1 youth initiative to end TB? And are you familiar with the content? And through this result, we could see like 57% of the people who give the answer are yes and very familiar, which is we're happy to see. And also, we're still seeing like 26% of those who joined us don't know about the WHO 1+1 youth initiative at all. So this is also what we want to do more for our work, and also in the next session. I hope when we finish today's webinar, everybody will know about our initiative and will take it forward to your future work in your country. Thank you, Monica. It's a quick sharing about the results.
Thank you so much, Yi. So, I mean, that's really a good scene setting to understand, who has joined us from where. And we have crossed, we are now at 56 participants, which is great. And we know that others are watching on YouTube or on our interactive platform. Thank you to all of you for joining. And it's good to understand how much you know about WHO's 1+1 initiative. As E pointed out, it's good to see majority, at least of those who joined at the start, did know about WHO's 1+1 initiative, but over a quarter of you were not aware of it. So this is an important opportunity to share this with you. So that's leading up to our next presentation from my colleagues, Madhusudan Kafle and Yi Wong. Madhusudan joined us a couple of years ago. He has founded a youth initiative in Nepal and also founded TB Free World, which he uses to promote youth engagement to end TB. And E both Madhusudan and E actually work with us at WHO, and they coordinate with me the work on youth engagement to end TB. And E also from the very start has been in the forefront of efforts at WHO to take forward youth engagement to end TB. So I now turn it over to both Madhusudan and E to present a progress update. It's been over a year since the launch of WHO's 1+1 initiative. What has the progress been both in implementing the initiative as well as the historic youth declaration to end TB? So over to you, E and Madhusudan.
Thank you, Monica. Hello, me again. Hello, Madhu. Greeting from Geneva. Hello, everyone. I will, if I may, I will get started. today is really a great honor for me to present a progress update on WHO 1+1 initiative and the implementation of Youth Declaration to NTB. I will, on behalf of our lovely team, our team lead Monica and my colleague Anna and Madhu from Nepal. So to give you a brief introduction and update of the progress. As you we could see from the this year's global tuberculosis report, we can still feel we can still see so TB is remain despite the progress over the past decades. So TB remains the world's leading infectious killer, claimed around 4,000 lives a day. So young people, so through these infographics that you could see, young people are disproportionately affected by TB, especially with the age group of 15 to 34 years. Those are being some of the most affected group of the person. Young people also from the majority of the population in the most of high TB burden countries. They are also the main beneficiary of the 2030 Sustainable Development Goals, including its aligned target of ending TB, as they started to inherit a better, safer, and healthy world. As such important stakeholders in the sustainable development agenda, in achieving universal health coverage and in ending TB epidemic, young people must be at the center of fight to end TB. And also, I would say young people have the potential to be the champions of accountability. As highlighted by the UN Strategy for Youth, they can hold leaders and organizations accountable for their actions towards achieving the ambitious commitment to end TB as set up in the WHO NTB strategy and the political declaration of the UN high-level meeting on the fight against tuberculosis. Oh my God. Oh, sorry. So as everybody probably have heard a lot, so in 2019, WHO Global TB Program launched the initiative titled 1+1 on the occasion of the World Tuberculosis Day. The initiative aims to advance the engagement and amplify the voice of young people in the fight to end TB. The 1+1 initiative relies on small actions that young people can excel at and the multiplier effect utilizing the untapped resource of youth. If each one can reach one, we can reach the millions. We need to end this epidemic. Through this image, I think maybe some of you have joined us in last year in Jakarta, July 15th. It's a historical time for us. It was our first ever youth town hall. Over 200 young people from all over the world pledged their commitment to end tuberculosis at this special event. Through a bold youth declaration on the fight to end TB, young representatives, including from high TB burden countries such as Bangladesh, India, Indonesia, Kenya, and the Philippines, outlined the key commitments and actions they would lead to accelerate efforts to end TB. The declaration is aligned to and will contribute to reaching the targets set in the political declaration of the UN high-level meeting by heads of states, the WHO NTB strategy, and 2020 Agenda for Sustainable Development. The youth town hall to NTB was really successful at the time, and the declaration result from the town hall highlighted in 6 key areas of the action that could benefit from greater youth engagement. As you could see from the list here, improving awareness about TB, fighting stigma and discrimination, providing psychosocial and social economic support to TB patients and their families, advocating for accelerated research and development for TB, advocating for increased in financing to end TB, promoting multi-sectoral action and accountability. Through the youth initiative, since the global youth movement 1+1 Youth Initiative, and also, as I said earlier, followed by the adoption of the Youth Declaration to end TB at the first ever Global Youth Town Hall on ending TB, there has been significant progress over the past years. The 1+1 initiative has expanded to including thousands of youth across the world in countries like Bangladesh, Nepal, India, Indonesia, Philippines, and Vietnam. The social media platform set up as part of the 1+1 initiative, joined and followed by more than 50,000 young people, including also our newly launched WHO NTB Forum youth group. And also through youth from everywhere, they can access our 2 official WHO website, Mobilizing Youth to End TB, and also the special content on the WHO 1+1 initiative. Since we established the Youth to End TB Global Youth Network, we're more than, as we could see, like 1,800 more youth from almost 95 countries who have already joined us. Besides, in order to recognize youth efforts and encourage youth engagement to end TB, youth stories was conducted from all over the world as well. So there are several images from our colleague Madhusudan, who has initiated and also organized a lot of good events at the country level in Nepal. And also there are like more than across the world, like more than 50 different youth-led activities and virtual events ending TB have been conducted worldwide. This including sensitizing young people, peer education, trainings in schools and universities, and encouraging them to become TB advocates, and supporting TB patients in the community with resources, advice, and encouragement. So, for instance, here is one of the inspiring example from Nepal, and also some pictures from the previous slides. Young people in this country have established national and provincial youth networks to help each other strengthen their capacity, building their capacity, and in ensuring their participation in the policy making and community level awareness building programs. Likewise, in Vietnam, in this year, March, in Vietnam, a national tuberculosis program launched the first ever national youth movement against TB, which aims on reaching 10 million young people, as well as educating all primary school students with TB knowledge and good practices on combating TB and lung disease. So we're very happy. Like today, the leader from this from Vietnam National Youth Movement, Dr. Thong Nguyen, and also Hai joined our today's webinar as well. So they will also share us their experience. Hello, Hai. Yeah, so let's move on to the next example. This is another exciting example from Indonesia. They have established an organization which works in 5 districts of DKI Jakarta province. Activities are mainly in the treatment phase of TB care. The girl who is standing in the middle is Parent Seminar Vinarni. She works as a peer educator that empowers ex-TB patients to become treatment supporters for those who are still on treatment. Their national youth movement against TB has been conducting in art exhibitions as well as creating TB awareness through social media campaigns. There are a lot of interesting campaigns that they're working on. So we also will, also as you could see, Farah is one of their members. So Farah, her story is really inspiring. And now we're very happy to see Farah has already completed her treatment, and now she dedicated her ecosystem into supporting other peoples in through the organization of the IMUD from Indonesia. So let's move on to the next section, the little actions that we cited on the youth initiative. Each one teach one. So as here we could see, this is a picture from Bangladesh in September last year. There was an event called Voice of Youth, was held in advance of the high-level meeting in Magdab Medical College, Dhaka, with over 200 young people participating. The event was really successful, and also they have adopted the youth declaration to NTB was adopted by the group, and also the commits were made to create a national youth movement to NTB in line with WHO's 1+1 initiative. So we have more medical students who has medical knowledge also joined us in the fight to our youth initiative. There is another example from Kenya. Young people are mobilizing through arts and stigma. They're reaching out to the communities and to really give the support at the front line and to teach the young kids and to tell them the basic knowledge about the TB and do the community education work. So here are the 2 images from the last 2 years youth symposium at the UNIN World Conference on Lung Health. This the UNIN conference, as everybody familiar, is the biggest event annually that happened concerned about the lung health issue. So we were happily to join for the past 2 years. Since the beginning, we established the youth initiative. And during the youth symposium, speakers from who has experienced TB, and we had TB survivors, and also who has, especially in face of stigma and discrimination, who has shared their stories and about their personal journey, how they became the advocates to help more people once they completed their treatment. And there are also several case studies and country experience from different countries like Vietnam and Indonesia. I would love to give you a short notice, and later my colleague Madhusudan will introduce this more in detail. In order to implement the number 2 section, each one teach one. So in the next year, we will launch a new youth training module on the official WHO training platform. So every youth can join wherever you are and whenever you can to learn more knowledge about TB. So let's move on to the next part about each one for each one. This picture was also from the last year's the first ever youth town hall, and there was a global selfie challenge called One Day Mask Challenge has been launched during the event, and since then we have the event is aimed to raise awareness on the stigma and discrimination faced by TB patients. Was taken up widely online. It was an online campaign that we initiated through Facebook group and also Twitter. So after that, there were a lot of youth joined us. I would love to see more to join. The campaign is still ongoing, and we would love to see more people to join. In the last year, so here we could see from this image, this is this year from the International Youth Day. We launched youth we launched another campaign, so which we would love to see more stories from the youth from that cross different countries. So there are, you could see the youth representatives from the global level and from each 6 regions. They all have their own significant stories. They've been working in the areas for so long, and then they have also working in a really, really different way. So here I would love to share one example from a young boy called Aisu Darasa. The boy standing here, the handsome guy from Ethiopia. He was he has initiated activity in their country. Mainly is comprehend the risk of the TB in the mine workers community. His activities to address this important issue included the organizations of the TB screening campaigns in mining areas. He contributed to screening about 9,300 people presumed to have TB. Of those, 141 people were diagnosed to have TB. He forces taking forward his initiative and implementing projects to improve the accessibility of healthcare services for people working in mining areas. It's really, really inspiring. So we would love to see, we have the information on our website. We would love to see more stories from you, from your country, from your community. And each one of you can share, and we would love to see your stories through our platform that we promoted to the world. and to encourage more people to join. So here I would give you some two examples. The one is from Indonesia. As you could see at the beginning, at the previous session, our distinguished speaker, Farah, who was cured by TB and also was supported by the Indonesia youth movement. This youth movement started initiated by parents Sami Minter, who experienced tuberculosis as well. After her long journey of the treatment, parent has noticed that this issue is not only relevant to her herself, it's also to the community, to more young people like her who assume to have a better future for them. So she started this initiative, and also I'm happily to tell you. So in the past 2 years, there were 24 TB patients who has supported by parents, and 12 of them has completed their treatment. Farah, the lovely girl who has just presented, is one of them. And now Farah is taking the lead, and she is continue to help others more. And another story from Hai. Hai is a young researcher from Vietnam. He is joining us as well. So, and also he is a medical doctor. With his knowledge and also his enthusiasm and his help, he is working closely with the patients at the National Lung Hospital in Vietnam, and also encourage them to speak up, to like this word, to learn, to hear their voice, to hear the voice from the patient, and to let everybody knows we need more help, and to let everybody knows we're not doing enough, and we should never give up, and we should continue our work. So here, if I may, I would love to show you a short video that directed by Hai, and also that is a moving story about the girl who has experienced the TB now, which is who is only 15 years old. Too long. Let me show you the. Then.
Why don't you proceed? We can go ahead. We can post the video. We are running out of time, so.
Okay. Oh, okay, Monica, I get it. So we can post the video later and share this with everybody. So here I would quickly by sharing some supports that we can have from the Global TB program. As you could, so that's want to let everybody knows we are really want to help everyone who are interested into our youth initiative, and you want to take the action into your countries, and also we're ready, we're here to support. As everybody familiar with that, so we have a good while wide range of the WHO guidelines and other WHO official publications that can support you in any case occasion that you need to promote about TB. Oh. And we're constantly organize the series of webinars. So we called it NTB webinar. Today's one is one of them. So in the future, we will send the invitations to everybody, and we hope to everybody can join us. And there are a lot of um, advocacy materials that we could prepare, we could provide. For example, take the occasion of the World TB Day and the World Tuberculosis Report Launch Day, and also other materials from WHO official theme days. So for the next step, we will focus on the three key areas. One is the youth training, and the next step is country support, which we will really love to do more work on that, and the youth community engagement. So now I would give the floor to my colleague Madhu Stan, who will present the next part about the exciting youth training module. Floor is yours, Madhu.
Thank you so much, E. Am I audible?
Yes, go ahead, Madhu. Just
Thank
speak
you.
louder.
Thank you so much, Monica. I have turned off my video due to connection problem, but I'll present this slide with E's screen. Thank you so much, E and Monica. So this banner we can see here from the International Youth Day event organized by World Health Organization, and we already knew that WHO announced WHO's Youth Council. So we are really interested and in line with WHO Youth Council, and with the support from our director, Dr. Teresa, we are really moving forward with our WHO 1+1 Youth Initiative, and to implement WHO Youth Declaration to NTV. Next slide, please. Uh, I would like to give you an overview of youth training course that we are currently developing. The overall goal and objectives of this course aims to train youth engaged or interested in being engaged in the WHO 1+1 Youth Initiative, and to provide clear practical guidance on how the young people contribute, and how the youth declaration and its commitments to NTV can be translated into concrete action at national level, subnational level, and community level. The target participants of this course is independent TV activists and advocates, young researchers and scientists, young TB survivors, university and college students, and any young people who is interested to join our youth initiative. So here are some of the key features of our course. There will be total 6 modules, and it will be a virtual training course, so that anyone can participate in this course and complete from anywhere. We will provide step-by-step learning to facilitate the learning process to everyone. We will have examples and real-life stories. It will be based on youth declaration to NTV, since youth declaration is the declaration given by young people themselves. So this module will be based on youth declaration to NTV, and it will be available at NTV channel of OpenWHO platform. There will be a free certification. We will provide tasks and questions for practical learning process. the learning time will be flexible. You can select your timing, and you can complete your course anytime. And it also can be used as a face-to-face training tool. We will also provide a workbook so that it can be used as a face-to-face training material. Next slide, please. Module 1 will be the beginning of course, and it will provide outline of how to study and use this training course. So it will be for 30 minutes, and here are the list of lessons. So it will be completed in 30 minutes. Next slide, please. Module 2 will be youth to in TV, the whole agenda and the progress. So this model aims to build a core understanding of the role of youth in TV agenda, and we will also provide the progress made. We will provide information on TV basics, and provide key guidance to the participants on opportunities that are available with us from Global TV program. Total module duration will be 90 minutes, and the module assessment will be from multiple choice questions. Next slide, please. Module 3 will be completely on WTO declaration to InTV. It will provide a core understanding of WTO declaration to InTV and its priority action areas. We will know all the answers. What are the priority action areas of your declaration to InTV, why they are important, and how we can achieve the targets on those priority action areas. So we will know all these from this training module. So it will be completed in 120 minutes. This is the tentative module duration. And we will also provide some case scenario and module tasks to provide practical knowledge to the participants. Next slide, please. Module 4 will be on initiating the work and mobilizing a youth movement in TV. So this module aims to provide step-by-step guidance so that each and every participant will know how to initiate a TV related work, and how to establish the youth movement, how to engage more and more young people together at different levels. So this module will also be quite interesting, and it will be completed in 90 minutes. Next slide, please. So here we have module 5 and module 6. Module 5 will be digital advocacy and social media movement. So in this time, social media movement, digital advocacy is really important, and all the young people are quite interested in digital advocacy and social media movement. So this particular module 5 will aim to enable participants to harness digital tools and techniques to strengthen advocacy and enhance social media presence to in TV. So it will be completed in 30 minutes, and the last module will be a guide to join WHO movement to NTB. It will provide step-by-step guide on how to join hands with us in our WHO 1+1 Youth Initiative and Global Youth Movement to NTV. Next slide, please. So here we can see Youth to NTV Global Network. I'm really interested to share this particular slide with you, because this is something we can see as a concrete progress. We have covered all 6 WHO regions. We have more than 1,800 young people from more than 95 countries, and it is growing rapidly. And we are looking forward to see all the young people from your circle, your friends, your university, and your college. You can join this network, and you can learn from that network. You can share your ideas and your problems, your issue with each other and with us directly. Next slide, please. Uh, these are the social media platform and our official WHO website. We have 2 specific web page on our official website from WHO. You can find all the information and necessary materials to initiate youth in TV related work in your community, so you can simply go there and find out everything. We have social media platforms. You can join our Facebook group. You can follow our Twitter. You can also join our official InTV forum, so that you can find lots of opportunities and lots of friends from different countries. These platforms are dedicated to you, so you can join anytime. You can join right now also. So please join us. Next slide, please. So the training manual will be available to official NTV channel at OpenWHO after the consultation with young people. So we will conduct 6 regional youth consultation very soon. In most probably in January, we have a schedule for youth consultation, and you can also participate and contribute during the development of training module. It is really important for us to know what you need. So we really want to make this training manual as a need based. So please join our youth regional youth consultation and provide your feedback, your content, your stories. We can also add your story in our training module. So this is really interesting and it will be fun also. So we really look forward to see your presence during our youth consultation, and we will also provide some other big opportunities in near future. So that please join our official InTV forum. Uh, uh, this is all from my presentation, and I would like to hand over to E for summarizing this presentation. Thank you so much.
Thank you, Madhu. I think, as you said, we welcome everybody to join. As we see the result, there are still have 26% of you who didn't know about the 1+1 initiative. But I hope after this presentation and also the introduction about the youth training module, you will be confident to join us. We're waiting for you. Please. Thank you. Give the floor back to Monica.
Thank you, E and Madhusudan. That was really very comprehensive. So it took some time, but as you can see, there has been a wealth of work done, led by WHO, by both of these young people, by Anna, under the leadership of Teresa and other colleagues. There's been so much that's happening. E quickly presented, in a nutshell, all the numbers and what has been achieved, and Madhusudan presented very comprehensively the course that he's been working on, along with that he's been leading the work on. And yes, we welcome all of you to join the consultations. E very quickly went through what resources are available at WHO. We invite you to go and download the Global TB Report app, which is available in multiple languages. It's very handy. It's definitely a guide for all young people to use. We have it in nearly 4 languages, so please do that, and we hope to have perhaps even a youth section as part of that app at some point. So given that we're running out of time, let me quickly turn to the next section, which is going to be an interactive youth panel. And for this session, what we'd like to do is we'd like to welcome all the attendees to start posting your questions on the Q&A function on Zoom. So if you can see at the bottom, there is a Q&A function. Some of you have already been posting a few questions. Please use that to ask your questions. We're going to have 3 speakers in this session, but we welcome you to also ask questions to people like Madhusudan, to E, to Anna, to Teresa, or to myself, or Dia when she joins. So please go ahead and do that. We will have at least a few minutes to look at your questions. So I would like to first start now with, we're very happy to welcome the 3 speakers in this panel. The first speaker is Poonam Subedi. She is, excuse me, a public health graduate and young researcher from Nepal. She is a founding member of the National Youth Movement Against TB in Nepal, and is working as part of the youth movement as a research coordinator. Poonam, please share with us. I mean, based on your background, we can see that research is really important. It's one of the key components of WHO's NTB strategy, of the Youth Declaration to End TB. Please share with us, how research and development is important and how young researchers can help shape the future of this agenda. Over to you, Poonam.
Thank you, Monica. Honorable Director, respected guests, and my fellow panelists. My name is Poonam Subedi, and I am a public health graduate, like Monica already mentioned, and I'm also a young researcher here in Nepal. And I've been working with the National Youth Movement Against TB in Nepal since the very beginning. And I've been rendering my service here as a research coordinator. And I'm very grateful to WHO TV program for having me as a speaker, as a panelist in this webinar. And well, I'll be highlighting about the roles of young researchers in TB research, working through the activities that undergraduate and postgraduate students in universities fulfill during their academic qualification that can be made meaningful in terms of TB research. Well, in my experience, in my academic experience as public health student, we carried out two residential a month-long residential field practices where we conducted research to assess the knowledge, attitude, practices in regards to health and diseases such as tuberculosis. And the thing I want to highlight here is that there are many public health students and like me, many colleges, many universities which are providing such programs which provide opportunities for young students of opportunities of research to young students, and they have been conducting many researches, many studies for their thesis, for fulfillment of their academic qualification. And if we are capable of assuring these researches quality, if we assure the quality of these researches, these undergraduate, even if they are undergraduate researches, these researches can definitely provide us with the facts on the existing situations in our communities, because tuberculosis has been affecting our communities from the very beginning, especially in the low and middle income countries. And with these true findings, government organizations working on TB can make evidence-based planning targeting the most affected communities in the aspects like TB awareness, TB prevention, TB treatment, and TB control. And well, annually, 906 million budget has been allocated for TB research, and recognizing these current practices and researches by undergraduate students, this can definitely, in a way, maximize the efforts being made in TB research in the most cost efficient manner. And on emphasizing the roles of young researchers can contribute in the existing research and development efforts, bringing youth perspective, ensuring more youth engagement, and also carrying out informed advocacy, and also alongside inspiring their uh, same generation youth with the access to right information and understanding. Likewise, we can seek for new facts and new findings on TB prevention, TB treatment, TB control, and also research to find new innovative interventions to end TB with appropriate research methodology, and disseminate these results to the concerned authorities like government and the related stakeholders and international agencies working on TB, because the recommendations, these research we'll make will definitely help in making evidence-based planning and making strategies and policies to minimize the TB morbidity and mortality. And last but not least, we as individuals, families, communities, stakeholders must recognize these young researchers' efforts and recommendations in our actions so as to uh, create a to create an environment that is stigma free, discrimination free for all of us, whether we are TB victims or not. And this will ensure that we have an environment where every one of us can seek, can reach, and can utilize TB health service. And this, at the end, will definitely help in minimizing the TB mortality and morbidity. Thank you for having me. That's all. Over to you, Monica.
Thanks so much, Poonam. That was really, really very inspiring. And yeah, it really shows the way how more researchers and other graduates and other expert and other young people can be more engaged. Thank you for sharing your experiences. I'd now like to quickly turn to Nyambura Muroki. She is a young medical student from Kenya, and she is currently working as liaison officer of the for the International Federation of Medical Students Association, which is a partner association with the WHO. She will share with us the role of young medical students or professionals. What role can they play in implementing WHO's 1+1 initiative, the adoption of the Youth Declaration? I mean, these are the future doctors, the future healthcare providers, or those who are going to be managing the health of the future. So, Nyambura, over to you. Look forward to hearing from you.
Thank you so much, Monica. Hi, everyone. My name is Nyambura Muroki, as you've heard. I am a Kenyan medical student based in Nairobi, but I also serve as the IFMSA Liaison Officer to Student Organization. IFMSA, as you've heard, is the International Federation of Medical Students Association. It was founded in 1951, and we currently represent about 1.4 million medical students from 145 countries across all the WHO, all the 5 WHO regions. So thanks for your question, Monica. And medical students play such an integral role. As you've rightly mentioned, first, we are young people, so we know exactly what's happening on the ground, and we represent a majority of people, of the population in countries that are affected by TB, with high TB burdens. Secondly, is we are the future of healthcare, and we are the future healthcare professionals. But not just that, but we are involved in the daily management of TB patients. And what that means is that we are highly exposed to TB and have even a greater risk profile, just like my colleague Farah Diba, who was extremely inspiring. Thanks, Farah, for sharing. So it's very important that we have medical students on board and aligning to the global action, the global action against TB. So I'll just say a few ways in which young people and young medical students specifically are adopting the global declaration. And one of the ways is through advocacy. So I started working on TB about 3 years ago. I was the National Public Health Officer in Kenya, in the Medical Students Association of Kenya. And while TB Day was coming up, so I just reached out to the Ministry of Health and the county government Ministry of Health as well. And they brought me on board as one of the people who are going to plan, one of the organizing committee members of the planners for the World TB Day. I was the youngest in the room and one of the few women. It's wonderful to see lots of women on this panel. But that was, so what happened is they allowed us to bring in medical students, and we advocated for youth participation. And we ended up being part of the screening activities for the World TB Day in 2018. And what that did is that it empowered young people and young students, because our training, as it were, doesn't expose us to the actual advocacy efforts, which are so important. And it teaches us the clinical aspects of managing TB, but not all the social, fighting stigma and discrimination. So being engaged with the National TB Program and the WHO Kenya office played a really huge role in building capacity. So many people across the world and in the countries that IFMSA is in are involved in advocacy and involved even within their national TB programs. Many, as you've heard, have formed youth networks. We have youth networks even in Kenya, where young people are coming together to educate on TB and raise awareness. The other thing that happens is that there's a lot of campaigns that medical students champion. You heard about Yasu, who is from Ethiopia, a medical student from Ethiopia, who screened over 9,000 suspected TB cases and got 141 cases. So that's that's just a microcosm of the kind of action that is happening. And I really love the tagline that little actions eventually lead to have big outcomes. So yeah, people are leading anti-stigma campaigns within their countries, building awareness. I know in Indonesia, they're using, and I think that's the power of being youth. We are creative and we are using new innovative ways. In Indonesia, they're using storytelling, they're using pageants, like beauty pageants. They're also using scenarios, and gaming has become one of the ways in which TB awareness is being spread amongst young people. There's a lot of medical students are also involved in capacity building. One way through which they're doing this is through their advocacy activities and just being on the ground and seeing exactly what happens, but also organizing trainings for healthcare professionals, other medical students and patients. In Nepal, there's an activity where medical students are disseminating the End TB strategy amongst healthcare professionals. So the End TB strategy will likely be influenced and pushed forward because it's 2015 to 2035. So the doctors in training right now are the ones who will make sure that in 2035 that we've made the gains that we had said that we were going to make, 90% cure rates and even more. Capacity building, we're also training. One of the challenges from 2018 when I was involved in the advocacy efforts is that there was no structured advocacy. It was a one-time thing, and then there was kind of a disconnect. So one of the things we're doing is that we're training young people to advocate and to have to meaningfully participate in advocacy. And then just prevention and prevention strategies and proper management of TB is one of the other ways medical students are involved in capacity building. I wouldn't like to belabor what my colleague Poonam has so well put about the role of young researchers. Medical students are also involved in research. I know of a medical student in India who has done a huge study on risk behavior profile of TB patients. And then one last thing that young people are doing is driving innovation. I think we cannot belabor the effect of innovation and the technology, how technology has, how technology is helping us in the health arena to solve problems that couldn't be solved several years ago. So we have young medical students working on innovations, so working on creating innovations, but also disseminating information about that information on strategies to treat MDR and XDR TB, but also there's digital adherence technologies and contact investigation. And many of these innovations have really come through for us in treating COVID, in managing and the whole chain of COVID-19. So TB programs have had a huge impact on COVID-19 strategies. So the other thing that IFMSA is doing is collaborating. We collaborate with students in pharmacy, with nursing students, and the whole healthcare team, just because we understand that just doctors cannot solve the problems of health systems, and we need each other. So collaboration is one of the ways that we're doing that. So just to in finally, I think that it's really valuable to have young people in the whole process, and I really love what Dr. Dia said, and just how WHO has put their money where their mouth is. Thanks, Teresa and Monica, because you have young people on your team, and they're not just tokens giving speeches at webinars like these, but they're actually involved in the whole process from planning to implementation. And I think young people are so valuable in changing in shaping the global agenda. Look what they've done with climate change. So I hope by the end of this, as we adopt the Global Declaration, we'll have a Greta Thunberg for TB. Thank you, and back to you, Monica.
Thank you so much, Nyambura. That was really, again, another very inspiring speech, very clearly highlighting what the different areas of collaboration could potentially be. What I really liked in what you shared is also the collaboration that you highlighted between National TB Program in Kenya, WHO Country Office, and IFMSA, and your work, which I think is really important, because when we look at sustainability, these collaboration points are important. It's not just start and stop projects. So as youth get more engaged, you need to know who are the players in the field. Like Farah, there is Pak Imran in the Indonesia National TB Program, who is such a big TB champion himself. So, engaging with him, or in India or in Nepal. I mean, we have so many focal points. I mean, so many people we can collaborate with. And of course, thank you for sharing the role of, students and how they can really contribute looking forward. Now, in the interest of time, I'd like to quickly turn now to Hai Nguyen, who is from joining us from Vietnam, to talk to us about the role of young people in bringing all of society on board. What are the key resource mobilization techniques that we can join in? He is a young researcher himself at Vietnam's Integrated Center for TB and Respirology Research. And he graduated from Hanoi Medical University as a medical doctor, and he's been leading the work on the youth movement in Vietnam, along with other colleagues such as Swang. So over to you, Hai. The floor is yours.
Thank you, Monica. Shall I share my screen? Host is disabled participant. So can you enable my screen sharing?
Okay. Hello. Hi. If you don't mind, I can share my screen and you present and let me know the next slide, etc.
Yeah. Okay.
Yeah. Okay.
Okay, so greetings from Vietnam. I'm Dr. Hai, and along with me is Dr. Thương. Say hello, Thương. So today we are going to talk about our story of an old society approach to NTB and the role of the youth in Vietnam. I will present our presentations, and then Dr. Thương will answer all of your questions. Next slide, please. So this is Vietnam, our beloved country in the Southeast Asia. And we are still one of the country with the highest TB burden in the world. According to our second national TB prevalence survey in 2017, the prevalence of pulmonary TB in Vietnam is about 300 per 100,000 adults. Comparing with the previous survey in 2007, the overall burden of pulmonary TB declined by 37% and smear positive TB dropped by 53%, while no change was found in smear negative TB. Next slide, please. Next slide, please. Yeah. So according to WHO definitions, you can press next slide, please. According to WHO definition, the social determinants of health, including political, social, and economic conditions in which people are born, develop, and live, work, and age. And TB, in turn, has its own social determinants that need our attention, including the infamous factors of TB stigma and poverty. Next slide, please. Yeah. Next, please. So in Vietnam, we found out that almost all MDR TB patients and their family have to face catastrophic costs because of disease. These social determinants, if not addressed, will inhibit the progress of ending TB globally. Next, please. So in 2018, we established the Past TB Foundation's a TB-specific social protections initiative with the aim to support poor TB patients with health insurance, financial aids, and monthly allowance. Next, please. We have many generous donors who contributed to the Past TB Foundations. Next, please. And with their help, hundreds of health insurance and stipends has been delivered to poor TB patients. Next, please. So if you are a young Vietnamese person and you want to help ending TB in Vietnam, what can you do? Next, please. You can join us in the Youth Society Against TB and bring the End TB message to the remote areas where people lack healthcare access. Next, please. In 2018, we organized the Move for My Healthy Lungs Marathon with the participations of nearly 2,000 people. This event was broadcasted in our national televisions to increase awareness of TB. And another aim of this marathon was fundraising for TB control interventions in Vietnam. Next, please. And in 2016, we organized a beauty pageant with the name of Miss TB. This event was also broadcasted in the national TV to increase social awareness of TB and to show off the beauty of our TB healthcare worker. Next, please. We had a photo contest with the participations of many people across the country. And the first prize belonged to the photo with a peacefully sleeping baby getting a BCG shot. Next, please. Our youth has organized many promotion events to help increase the funding for Past TB foundations. And these events also to enhance social awareness of TB. Next, please. We also made a music video and used the power of social media to increase the awareness and reduce misconceptions about TB in our community. Next, please. We believe that our children should be aware of TB at a young age because children are our futures. Therefore, we held many talks with elementary students in major city in Vietnam about TB. And next week, we will have talks with high school students and university students as well. Next, please. So in conclusions, it's time to take it from action on TB to action on TB social determinants. Us young people have a great responsibility in advocacy, communications, and social mobilizations. Next, please. And we are all in this together to end TB. And this is the end of my talk. Thank you for listening.
Thanks a lot, Hai. That was really very clear, and thank you for sharing all the exciting developments in Vietnam. Sorry. So now Yeah, and I always love the beauty contests that you show, because it hits at the root of stigma and discrimination. Excuse me. And it also at the same time promotes health workers. So thank you so much. Sorry. Now, I'd like to, we said we would have a few minutes for Q&A, which we can come back to. But before that, I'd like to turn to my young colleague, Anna Stukulova, who also works at the WHO Global TB Program, excuse me, to share with us an exciting new platform we have. Over to you, Anna.
Thank you, Monica. Hello, everyone. My name is Anna Stokalova, and I work in the WHO Global TB Program. And today's meeting is an extremely important one, and I'm very happy, excited, and proud to be part of it. And we in WHO and we as youth never stop inventing something new. And one of the next steps to strengthen our youth community, engage more people, work more closely, always keep in touch, share the latest news, ideas, updates is our new WHO NTB forum. Now let me please share my screen and guide you through it. Yes, so I'm not really good in promotion and advertising, but we were really inspired and have been working really hard to create this community. So hopefully you would be as inspired as we are and join us. In general, this forum contains of several groups, or as we call them, networks, but the most important of them is, of course, our Mobilizing Youth to End TB network. On this slide, you can see the main page of the group, how it looks like in general. I would also like to say that we launched the platform in test mode a couple of days ago, and I'm very proud and happy that 227 people joined us in only 2 days. On the right of this slide, you can see that we have very proactive youth who is communicating with each other, posting and commenting. And I again want to mention that it is only 2 days old group. The main advantage of the platform is that all participants are united by one goal and has common interests, in this case, to contribute to our work to NTB. To share the ideas, upload videos, communicate, organize different events, share materials, and invite friends. And our goal is to provide you all the necessary networking tools for that. Some words about the tools. First of all, Events tab. On this slide, you can see information about our webinar, and you can always be aware and updated of all the upcoming or past events, get more information about them, like on this slide. But the most important thing we're mostly proud of is that you can join and watch any webinar, any meeting online using the same platform. And you can see on this slide that we are really going live now, and people commenting and leaving their comments. Those, of course, who are already part of this platform. So we again encourage you to join us. Another tab and tool is Media Center, where all the related documents and information that you might be interested in is collected. News tab for you to always stay updated and tuned. And it's also important to mention that every profile is unique, and you can create your own custom one, decide what information you want to share about yourself. This is a profile of our leader, Madhu, who decided not to share any information except of his photo. But I hope you will also customize his page and put something about him. Another tool is Forum tab, where you can open new discussion on any topic you are interested in, or join already existed one, like you see on this slide, discussion of the webinar. And we again encourage you to join it and exchange your thoughts and feedback after our event. I'm also very happy and proud to say that during this 2 hours meeting, 3 new participants joined us, and now we are 2029. And I just want to say that we can together make not only this community, but our future bigger, brighter, stronger, and to be free. And now to show all of you. So here it is, we're live. I can show you that we're really going live. And I want to create new post on our platform and encourage you to like my post and comment on that. We are waiting for you to join WHO's 1+1 initiative. Join. Sorry if I'm making typos. Yes, of course. Join us, publish, and you're welcome to like it and leave your comments. The link for the community is going to be shared in the chat in a second. And thank you, and back to you, Monica.
Thank you so much, Anna. And as you can see, so Anna Stukalova is actually leading all of this work on the platform. It's called WHO NTB Forum, and as part of this, we have the Youth to NTB interactive platform that she just showed us, and she showed it to you live towards the end, so you could see that we're all connected, how easy it is to post things, build your profile, network, because it's all of us who can support each other. And Anna has just posted the link on the chat. Please do click and join. We'd like all of you to be part of this youth movement to NTB. So now before we go to the closing, I'd like to quickly go to the Q&A to see if there are a few questions that we can answer online. There's Lucy who said in Botswana, we would be interested in holding a youth town hall. We have young people in high schools who are passionate about ending TB. How can we go about with organizing one? So I can quickly answer this one to tell you that we organized the Global Youth Town Hall to NTB in Indonesia with the support of a local organization called CHISTI with WHO Country Office Indonesia, and with the national program. It was a full partnership, and it was the first Global Youth Town Hall to NTB. We would very much want to now start organizing town halls regionally. The one that we organized, the global one that we organized in Indonesia, had over 250 young people join from around the world. And so we would definitely in 2021 want to organize more town halls, and maybe the African region can be one. So, or we could go for national ones if you prefer. And we would welcome you to be part of this group. So I look to the panelists. I know that some of you were part of the town halls. Would anyone like to add? Please go ahead. If not, Farah, you were part of the town hall in the Global Youth Town Hall that we had in Indonesia. What did you think of it? Would it be something that we should be pursuing regionally?
I think the event, that I said before, it wakes me up, and I think this is so important for us as a young people, for collaborating and to encourage others that events so important, I think, and that touch my heart. And I think with with you know with all of uh, all of the peer supporters, I think that they can they can change our world. So I think, yeah.
Thank you, Farah, and sorry for putting you on the spot, but yes, it was good to hear from someone who attended the town hall itself. It indeed is something that we should pursue. Another quick question is from Siva from Indonesia, who says, I'm Siva from the TB Indonesia Youth Movement. The training module initiated by Madhu is a great idea, and he fully supports that. What do you think is the best approach we could use to reach the targeted populations to join the training? So for this, I'd like to turn to Madhu Sudan, who has been coordinating the work there along with E and Anna to respond. Over to you, Madhu.
Thank you so much, Monica. Thank you so much, Siva, for your question. This is really wonderful to see your question and to meet you during the town hall, and we are also meeting in various meetings in past time. So the idea of creating a online course is to provide this opportunity to many young people across the world. So this will be completely virtual, and it will be very easy to receive the training in the official InTV channel of Open WHO platform. You simply need to log in or create an account, and then you can join the training course, and you can complete anytime you want. So this is the idea. And to reach more and more target participants, we have created a global youth network from more than 95 countries. We have a large number of young people with us. We will immediately send the information regarding the consultation as well as the availability of training course immediately to all the young people who have registered officially to our network. This is one thing. Another thing is we will also announce from our official website as well as our official social media channels, so that we can reach more and more young people. And we will also coordinate with our regional offices and country offices and national tuberculosis programs as well, is to engage more and more young people in those regions as well as in those countries. So this is the idea and strategy that we will apply to reach our target participants. Siva, over to you, Monica.
Thank you so much, Madhusudan. E or Anna, would you like to add?
Monica, I just want to quickly comment one the technical way how we can reach out to this platform. So once we have conducted this training ready, so this training will be featured on the official WHO training platform, which called Open WHO. It's an open access. It's no matter where you're from, and you just use the internet with the link to the website, you can access to our course. So that would be a really easy way to reach out. So we're looking forward to have this training form featured on the platform. Thank you.
Okay, so thank you so much, Madhusudan and E, and we invite all of you to keep an eye out on all of our platforms, the interactive platform that Anna mentioned, to the websites, and if you haven't signed up already, please sign up for our WHO Global TB program news flashes for all the latest information from the guidelines that WHO develops to the various support that we are offering. There's a lot of work being done on TB and COVID, which are quite interlinked. We have a whole, a whole area of work around that. We're also working, and this my director just reminded me, this year we, just a month ago, we released our the UN Secretary General Progress Report on ending TB. There are 10 priority actions, and we should work together to see how we, as the youth community, can help implement these 10 priority actions so that countries can reach the NTB targets that we have set by 2022 in the political declaration of the UN high-level meeting. So, excuse me, I see now that we've answered most questions. I also see Chris has raised that they would like to do an information session as well. There are questions on the Youth Council. We will share with you more information after this webinar. I would like to now take the opportunity to thank all of our speakers and all of you participants for making time to join us, despite this being the start of the holiday period. We very much appreciate your commitment and dedication to ending TB. I'd like to give a big shout out to my young WHO colleagues. Anna and E, can you spotlight yourself? And Madhu, can you put on your video? I'd like to again show you who are the young people who are really leading this work at WHO on youth engagement to NTB. So you can see that's E Wong, that's Anna Stikolova, and can you spotlight Madhu, please? And that is Madhusudan Kafle. And you can see that it's indeed a global mix. And all of us are, good to see you, Madhu. And so you can see it's a global mix. And we're all working hard to mobilize the engagement of young people to NTB under the leadership, of course, of Dr. Teresa Kasaeva, Director of WHO's Global TB Program, who I'm going to turn to next to deliver the closing remarks. Teresa, thank you for staying on. And I now look to you for the closing remarks for this very incredible and interesting webinar. Over to you, Teresa.
Thank you very much. Thank you very much, dear colleagues, Monica, and my young colleagues from different countries. I was really inspired and impressed by your vision, by your engagement, and by your interest to join us in the fight against TB. This year, this very unusual, challenging year is coming to an end, but unfortunately, we can't say that TB is also on track. Our fight against TB is on track, and that we are close to the ending of this disease. We have target to end TB by 2030, but according to our progress report, what unfortunately is not on track. And we should double, triple our efforts, and without your energy, without your innovative vision, and without your skills, it will be extremely difficult to do. Just bring you a few numbers. You know that annually, as E also presented, we have around 10 million people falling ill with TB. We have around 2.9 million so-called missing people. We had from 60 to 70 wonderful participants of these events, 60 to 70. And we have much over than 1 billion young people in the world. Imagine, just simple calculation brings us ideas what we can do, and it will not be, if young people will come all together, will not be extremely difficult task at all. Even in one of the highest burden countries like India, we have more than or around 300 million young people. And compare now with the number of people falling ill and missing. It's absolutely possible for us. And I'm so happy that this young movement is growing. and we need you definitely. And let's continue working together. I will be personally happy to hear your ideas. Please don't hesitate, even if you have some crazy ideas. These crazy ideas, they're changing the world. And we are looking you probably sometimes we're too traditional in our approaches and vision. Let's change our focus. Let's shake the ground and try the best ways. We can't complain. We can't that we are busy. We have different duties, and the world is so difficult. Imagine if we compare all our problems with the problems of people suffering. And we've heard today from our young leader. It was such a touchy speech from Farabida. So what are their hardships? These things are uncomparable. Definitely, we will do the difference. And despite of numerous problems and challenges, there are much more opportunities. We have now faster and safer and fully oral treatment options for patients even with a drug resistance form, with the most severe. We have new diagnostics in the pipeline. We have 2 vaccines on the phase 3 and TB vaccines. It's for the first time for more than 100 years. And really we need to push, we need to advocate because we're comparing with COVID how things are developing fast. We have now, in the short term, we have hundreds of new tools, diagnostics, medicines, and even vaccines. It's possible. And when we are looking at the financial gaps for TB programs, the chronic underfunding, and now comparing that in the short term, we can receive even from the domestic resources all necessary funding. It means that this level of understanding and responsibility for TB should be elevated, should be in place. We can't tolerate anymore, and we believe in you. We believe in our fruitful collaboration, and we'll be happy to work with you next year. I wish you and your families all my very best. Please stay safe. Please stay with us, and we will definitely together end TB. Thank you very much.
Thank you so much, Teresa, for those motivating closing remarks. We are very grateful for your leadership and support. And again, I'd like to thank all of you who've joined. We have run over time, but what we'd like to do, if you are available, Madhusudan has prepared a little Kahoot quiz. So if, for those of you who are still available to play, this is, after the meeting ends, a little bit of fun. So Madhusudan will share, and let's see what we can end on a quiz note. So Madhusudan, over to you for the quiz.
Yes, thank you so much, Monica. I think I need the access to share my screen.
Anna, please make Madhu co-host.
Madhu, is it okay now? It should be.
Yes. Thank you so much, Anna.
Good.
Can you see my screen now?
Yes, thank you.
Okay. So we are going to start an exciting quiz session at the end of this webinar, and I would like to suggest if you are using your laptop to see the webinar session, I would like to suggest you to use your smartphone to log in this Kahoot and enter the pin. I am also trying to share the link with you in chat.
Well, it's simple. Just go to www.kahoot.it.
Kahoot.it, yes.
Yes. And then you can put in the
then,
game pin.
234 2675. This is the game pin. So yes, we have one player already. We have Sarina, we have Farah. Can you hear the music, beautiful music of this quiz? Okay, so I see only three. Are you all joining this quiz? So now I will start this quiz, and if you cannot see the questions in your mobile phone, I'll also read the question myself. You can also see my the first one is tuberculosis is communicable disease. True or false? So we are jumping to next question. Here is another question. TB is caused by Salmonella typhi, Mycobacterium leprae, Mycobacterium tuberculosis, and Bacillus anthracis. You have 20 seconds.
So, Madhu, just to check, I think only 3 people can sign in. Is that correct?
Yes, Monica. Here is another question. Tuberculosis spreads through option A, contaminated water, droplets in air, contaminated food, and all of the above. So we are jumping to next question. What proportion of people living with TB are co-infected with HIV? 80%, 9%, 20%, and 75%. Red 80%, blue 9%, yellow 20%, and the green one is 75%. Okay, so now we are jumping to next question. Who discovered tuberculosis? Option A, Louis Pasteur. B, Marie Curie. Uh, Option C, Anthony van Tuberculose. And option D, Robert Koch. Uh, what are the major symptoms of TB? Persistent cough, fever and night sweats, weight loss, and all of the above. TB is a curable and preventable disease. True or false? So we have next question. Tuberculosis is present only in poor countries, rich countries, high burden countries, and all countries. how many people die of tuberculosis each day? 1.4 million, 6,500, nearly 4,000, and 2.5 million. So this is the last question. Who is a famous actor fell ill with tuberculosis? Option A, Amitabh Bachchan. B, Will Smith. Emma Thompson, option C. And Angelina Jolie, option D. So here we are at the end of this quiz, and we can see the winner here. Sarina got 5,891 score, 7 total correct answer out of 10. Congratulations, Sarina, and thank you Farah, Sarina, AR, and everyone for joining this quiz.
Yes, thank you, everyone. So we will post this quiz also on our platform. It's a very good information resource. So you can remember some of the TB basics. Also remember that TB is not just restricted to poorer countries or countries with a high burden, but actually it's present in every part of the world, including here in Switzerland, where some of you are connecting to you from. So so this is really an important resource. Congratulations, Sarina, Farah, and AR. It's really good to have you join, and thank you, Madhusudan, for doing the quiz. So with that, look forward to continuing our collaboration. Thank you so much, and best wishes for the coming holidays. Bye-bye.
Bye.
Bye. Thank you, Monica. Thank you, everyone. Happy days.
Thank you. Happy holidays, colleagues.
Happy holidays.